Good afternoon, everyone. Welcome.
Well,
Can folks hear me okay?
yes, we
Folks hear
can.
me okay? Good afternoon, everyone. Can folks hear me okay?
Yes, we can.
Yes, we can.
Great. Can you
Yep.
guys, can you all see the slide deck as well?
Yes, we can.
Yep.
Wonderful. All right, great. Well, welcome to office hours. Happy January, and I hope everybody's doing all right from the snowstorm we had yesterday. We're all here safe and sound. I wanted to get started. We're a little bit after the hour here. As always, we have this recorded and we'll have it available in the near future up on our website. We'll have the chat function going today as well for folks for anything along the way. And we've got our agenda that we'll get going on here. Anything that you want to bring up along the way as well, please feel free and we'll stop for discussion. But I thought we'd just start and get going. So with that, we'll start our slideshow here. We're going to touch on policy and procedures, data done, quality notebooks, redesignation results, plan of care compliance concern that we've been talking about, children's updates, health home serving children training requirements, and then anything else that anybody wanted to talk about for today. And then we'll be wrapping up after that. So with that, we'll jump into things and we'll have our first policy update for the day. I don't know, Jessica, if you were on.
Here, I'm here. Can you hear me?
Yes.
Alrighty. So we do have quite a bit of policies that have been updated, partly because we didn't have office hours in December, so we're a little backed up on presenting these. So the first one we have for today is our annual review for your activities and billing protocols for newly referred members that are coming from an excluded setting. So this is when you get a referral and that member is still residing in that excluded setting. Kind of what are you supposed to do? No updates to this policy. We can work with members and we can enroll members that are still in excluded setting as long as they're going to be discharged within that next 30 days. Except for folks who are incarcerated, that still we have to wait for them to be out and their Medicaid to be active. And then the one thing to keep in mind is that if you're working with any youth that are being discharged from an excluded setting to health home, you always want to make sure that they're evaluated for HCBS. That doesn't mean you have to go through with everything and collect all your documents and do the level of care, but you do need to offer and educate the family on what is available to them. Does anyone have any questions on this policy? Alrighty, you can go to the next one. Next, we have CANS and the UAS assessment. So this is going to be exclusive to children only. So we're almost a year into it that we've combined our CANS NY assessment in with the comprehensive assessment, and that is now one assessment housed in the UAS. This was an annual review. The one thing that we did modify in this policy is that we moved the timeline to 56 days. This allows the policies to align with those quote unquote due dates because you have to have the plan of care due at 56 days. The comprehensive was due at 56 days. Moving this policy to 56 days just make sure that everything is in alignment because you want to make sure that you're doing your assessments prior to doing your plan of care because you take those strengths and needs from your assessments and you incorporate those into the plan of care. We also did add a little bit of verbiage about what to add in those free text boxes when they appear at the bottom of your domain. So it kind of goes over what to put into those sections. You can move to the next slide. And what you're going to do is as you go through and you walk through the domains and the modules, you want to make sure that anything that you're rating as an actionable item, so that's going to be a 2 and a 3, in those free text boxes, you want to make sure what documentation or what you are referencing to support those ratings. So why did you rate those items actionable like you did? And remember, this is all being pulled because you have compiled supporting documentation, you've spoken to the family, you've had meetings with the member, and you've also had that interdisciplinary team meeting. So based on all of that feedback, and what you've gathered through that process, that is going to support your actionable items. Again, those free text boxes, they don't have to be lengthy. It could be a sentence, 2 sentences, but you just want to make sure that you're incorporating what you use to make that determination. And lastly, we did add some new appendix to the CANs that just have some CANs information sheets. This is more how to register for those new trainings that you have to do. So not everyone has to do the recertification. You have to redo it's like a half-day training, live training. That is going to be a standard moving forward. Any questions on that? All right, you can move to the next one. Next, we have Children's Plan of Care. A couple updates here. It is an annual review. One of the things that we wanted to point out and put clearly in policy, not that it wasn't before, is you want to make sure that your professional network and your care coordination tab has your quote unquote care team populated in your care coordination professional network tab. This is important because right now we export your plans of care out of NetSmart and we import those into MAP, and then anyone can go in and look at them. If your professional network and your care coordination tab is blank, your plan of care still imports, it just does not show any information. Future state, there will be an update to MAP where that information will be required. So the plan of care will export out of MAP or out of NetSmart, and when we go to import that into MAP, it's going to reject because you don't have all of your information in there. So in order to be proactive, we just wanted to make sure it was really clear that you go in and that you have somebody on that professional network tab for your member. So this could be anybody you consider part of your care team. And we understand sometimes, especially when we start working with members, you might not have a huge, robust care team because they're not really connected to the services that they have, that they need. So you don't have those in place yet. So you want to make sure at minimum, like the primary care is on there. So future state, it will import into MAP. So this is just something proactively that we want to make sure everyone is looking at. And the other piece that we wanted to really hammer home, and Travis is going to talk about this a little bit later, is making sure that a plan of care is not finalized until the member has signed it. So member and caregiver in this case, or just caregiver, depending on the age of the child, we will not consider a plan of care finalized and billable until it has a signature and it is uploaded into NetSmart if you were doing a wet ink signature. You can go to the next slide. Ideally, all of our plans of care will have that electronic signature. So then that takes all of the guesswork out of it. If you cannot do that, you want to make sure current state you're leaving it in draft, getting the signature, uploading it, and then do not forget to go back and finalize that plan of care. We have identified a few plans of care that have just not been finalized because the care manager forgot to go back and do that step. Again, future state, this will be resolved with the fix in NetSmart, but we want to make sure that we pointed it out that a care plan is not billable until it has member signature. And then we've also added a kind of SMART goal sample sheet to the appendix. So if you have a behavioral health goal that you want to work on, well, what does a behavioral health SMART goal look like? It is an example. You do not have to use it verbatim. It's just helpful to have something to reference, especially if you have newer care managers that aren't used to writing SMART goals. Does anybody have any questions on the Children's Plan of Care policy?
Just I have a question quickly. Do you know if you're can we put consents through the professional network on the care coordination tab yet? Or is that still not flowing over?
Thank you for bringing that up, Tanya. This is going to go for children and adult. You're going to want to put all of your professional network tabs and your consents and everything in the specific location in NetSmart where it asks you for it. You don't want to do it through another function. So also to this would be if you're walking through the comprehensive assessment, you don't want to put your problems in there. You don't want to put your professional network in through that. Sometimes it works, but we have been having an ongoing issue where it does jam up the system and that information doesn't carry over, and then you cannot finalize something. So you want to make sure that whatever piece of information you're entering into NetSmart, you want to put it directly in the appropriate tab or section where that information belongs, rather than relying on that push and pull technology, that functionality that does not always work. Any other questions? All right, you can move to the next one. Next, we have Health Home Disenrollment. This is for adults and kiddos. This is an annual review. There was no change to policy at all. The only thing we did was add a new desk guide. And what this desk guide does is kind of walk through the end reasons you can select in NetSmart, and on the right-hand side, it will go through why you would use that end reason and when to use it. So hopefully it'll just help guide using our end reasons a little bit more appropriately. When we're audited by the Department of Health, they do look at our end reasons and make sure that we're using the appropriate end reason. We will go into detail next month on our redesignation for children. Travis is going to give you some highlights today, but one of the things that we were dinged on was that our end reason was incorrect. So we'll kind of go through those things in detail next month. Today's going to be a high-level overview, so we thought that this desk guide would be helpful for you guys to help guide you to use the correct end reason. Does anybody have any questions on the disenrollment policy? Okay, next slide. All right, next we have Health Home Informed Consent. So this is our consent policy. This is for adults and children. Annual review, there's no change to policy. The only thing that we did want to highlight and point out is that every time a member is enrolled in Health Home, they have to have that electronic recorded consent in the system. So you do that through your client search note, where you record consent electronically. There have been some hiccups where the red asterisks of the requirement have not been in the system. We've since corrected and turned that back on. So there were a couple of instances where people were quote unquote enrolled, but not really, because their consents were never turned on. So we just wanted to point out that it has to be electronic consent. Again, no change to your current workflow because that should be done. And the other thing, going back to that professional network, we really just want to make sure that we're proactive about making sure that professional network is completed. So when the time comes to import our plans of care into MAP, they're not erroring out due to not having a care team. Does anyone have any questions on the consent policy? Okay, next. Super quick, not going to go into grave detail on this one. Our HCBS waiver participants' rights and choice. This is for children only who are enrolled in the HCBS waiver. Annual review, no edits. So the policy stands just as it always has. Does anyone, however, have any questions on this policy? Okay, next. Next is our OPWDD eligibility policy, annual review, no edits. About a year ago, it did have some edits as far as just clarifying who was responsible for what. But since that update, there have not been any updates to this policy. Does anybody have any questions? Okay, go to the next one. Next, we have our plan of care for adults. So this was an annual review and just a couple of edits and clarifying information that we wanted to include. Again, we just wanted to point out that all plans of care must be signed. The plan of care is not considered billable until it has a signature on it. Preferably, your plans of care will be signed electronically. If not, if you cannot get that electronic signature, then you are going to leave the plan of care in draft, have it signed, upload it into the system, and then go back and finalize it. Again, that is temporary until the resolution and the new workflow is finalized in our production environment. So continue to follow that process. And then the other thing for adults is that if you have a member enrolled in AOT, they can refuse to sign their plan of care. Prior to this, care managers would just put refused in the box. Now there's a specific checkbox that if you have the AOT sub-program in NetSmart, it will trigger that box to appear. So if an AOT client can absolutely sign their plans of care, but if they're refusing, there is an option for you to check a box now, and that plan of care will be fine and you will be covered. Does anybody have any questions on the adult plan of care? Okay, next.
Yes.
Oh, go ahead.
If we, get it signed in draft and then we upload it and then finalize it, does it need another signature once it's finalized?
Nope. You only a signature on that draft policy is sufficient. You don't have to have it signed in draft, finalized, and then have the finalized version signed. Just that one signature is okay.
Okay, and let's just say, for example, we were going out on a home visit to have them sign it. It's in draft, but then we talk with them over the phone. We thoroughly read it to them before we go on the home visit. Can we then finalize it and have them sign it, or not preferably?
So you don't want to finalize it until you have signature, because you can never guarantee that you're going to get signature. So if you're in the office and you're doing it and then you go out to the person, if you can get an electronic signature on it, that's perfect. But if you can't, you do not want to finalize it until you have a signed plan of care in front of you and uploaded into NetSmart.
Okay, all right, thank you.
Mm-hmm. Any other questions? All righty, we'll go to the next one. Next is our notice of decision and fair hearing. There are no changes to this policy. Everything stands as is that it was before. So this is for notice of decision, fair hearing. This is adults and children because this covers all of our notices of decision in health home and notice of decision for HCBS waiver for kiddos. So does anybody have any questions on this one? Okay, we can go to the next slide. Non-health home policy is next. So for those folks that use the non-health home sub-program in NetSmart, annual review, no changes to this policy, but I do just want to point out that you want to make sure that if you are going to be working with someone and you need them either input in a non-health home program or move to a non-health home program, please email that to the main health home email for that request. Don't one-off email some of us because there can be a delay in us getting back to you. So I just want to make sure that everyone is going to the main health home for that request. It's also considered like a referral, so it would go through our referral line for us to get those programs in. Does anybody have any questions on non-health home program? Okay, next. Next, we have outreach and engagement. It was an annual review with no updates, so policy stands as is, and no updates to workflow or policy from the state. Does anybody have any questions on outreach and engagement? Okay, we go to the next, the last and final one. This is our staffing qualifications policy. This is an annual review. This is applicable to both adults and children. The one thing that we wanted to point out on this policy is that we have updated the desk guide for the required training specific to children. So our folks that are serving children, we have updated that personnel checklist. It's out there for you to use. You do not have to utilize it. What it does, it'll offer you various resources on where to access those trainings if you would like to gain access to those trainings via that way. You can also use other trainings. We as a health home do not specify where you have to get your engagement training from. So we just offer that as a resource. What is required and has not changed is that those trainings have to be recorded into IRAMS. The one update that we have updated to put really super clear is that you have to have certificates for those trainings. So current state, you take a training, you report it into IRAMS that you have done it. So supervisor is doing that, someone from HR. We, as of this month, we are now, not just us, every children's health home is being audited by the Department of Health to make sure that we've attended those trainings. So they will pull a sample of care managers and supervisors across the state out of IRAMS. And then they're going to come to us and say, hey, you said on this date that you attended motivational interviewing. Can you please provide me with a certificate for that? So we want to make sure that we're only taking trainings moving forward that have certificates. Again, that personnel check sheet has been updated to include trainings that offer certificates. There are 2 trainings that if you cannot access, we do have access to that do not provide certificates. One of them is something that the health home has put together, and we will offer certificates, but they need to be requested through the health home. So moving forward, you just want to make sure that you have all of your documentation to support what you have put into IRAMS for your children's population and your children's care managers. Does anyone have any questions on that? And there was an email that went, Travis did put this in an email and he sent it out, I'm going to say early last month, but I could be off on that date.
It was early December.
Any questions? All right, that's it for me. If you have any questions, please feel free to reach out to me directly if it's about policy.
Thank you, Jessica. All right, data den, it's back and live. Not all encompassing, but we were able to get, or I should say Taylor, predominantly working with one of our data analysts, was able to get the reports that you see on the screen up and active. So for those of you who are interested, you can go in and get the member quick list, no initial plan of care, overdue upcoming plan of care, no initial comprehensive assessment for the adults specifically, no overdue upcoming comprehensive assessment adults, submissions, initial assess due by month, contact summary, and then the finance report for your organization. So those are all highlighted on the right there that you see on the snapshot for the navigation screen. And everything that's still grayed out are reports that will be coming at some point in the future that we don't currently have up and back, but we will be working on. We're excited about it. Sorry it's taken so long, but it's been a matter of reconnecting and rebuilding those reports on the back end, which has been very time consuming. But feel free to get back in there. So I didn't know, Taylor, if you had anything else you wanted to add to that, but feel free to go in as of now. They're back and active.
No, nothing to add other than I've just, like Travis is showing on this screenshot, the reports that are available have like a little yellow highlight on them, and they will link directly to the report. Everything else is grayed out and you can't click on it. So You'll see the ones with the highlights in there. You should be able to navigate right to those. And if you guys see any issues, feel free to shoot me an email and I'll look into it.
Perfect. Thank you, Taylor. Quality notebooks, they will be starting to go back and play now that we have Data Den going, and we're looking to get those started up in the month of February. So again, thank you for your patience and understanding, but we'll get those going again and get that back in cadence on a monthly basis. So that's our next exciting announcement. We're excited to get those back. So look for those as of next month as we get going. All right, redesignation. So here's the key. I wanted to start this off by letting everybody know we're going into the redesignation last year at the same time that the plan of care issue was brought forward. So the Department of Health looked at that in tandem with our redesignation process. So this redesignation process had that component to it. So you're going to find as I go through the results that we did very well with the redesignation, but the plan of care issue is factoring into this redesignation process. So you're going to see the results did not come out favorable in our redesignation, but we did very well specific to the domains and the redesignation. So we'll go through it and you'll see what I'm saying. But I want to preface this before I get into it so you'll get an understanding as I'm talking through. The network did very well through the domains, and the work that we do is very strong, but our plan of care issue is a concern and we have to address it. And we are addressing it. We're going to address it. But that's an issue that we're facing. So that's the reality that we're in, and the Department of Health is holding us as a region, as a lead to fix this and address it, and we have to do that in a short time frame. So I'm putting that out there before I go through the next set of slides, and just want everybody to know that. But before I go any further, I just wanted folks to see this as a redesignation key for the tiers. It didn't change from the year prior, from when we went through the adult redesignation timeframe, and how the scoring would go for folks, for how they would land based on how their performance went. And with that, we'll get into it. I didn't know if anybody had anything before I went any further, but here we go. So domain 1, we got 100%. That was our quality and compliance section. If folks remember, we got 100% the year before on our adult review. We did the same for our children. So that meant for our quality and compliance across the network, all the organizations met that standard. So congratulations, everybody did a great job. We really appreciate all your efforts and partnership on that. It's great work. It's a nice job, and can't do any better than 100%. So it's fabulous. An outstanding job. So thank you all for everything you do with every day on that. I don't know what to say. I mean, it's just 2 years in a row to hit that standard is phenomenal. So I mean, it's speechless. I keep telling the team, I mean, how can we pull that off? It's 100%. So here we are, and the state was impressed by that as well. Domain 2 is our quality and process measures. We hit 85%, which the Department of Health said was unheard of. We were one of the top echelons in the state. We were like up there. There was only like 1 or 2 other health homes, they said, in the state that was up in this percentage, hitting those quality measures. So we were 1 out of the 6. We only fell below in 1 out of the 6 in those areas for process measures, where we didn't meet in the percentile that we should have. That's just like phenomenal. So we did very well in that area as well. So congratulations. We did a nice job there as well. Just like blew it out of the park. And then on domain 3, that's our chart reviews. That's where they went through and they looked at all how we did on the charts that they pulled across the network, and they looked at all the different areas. We scored a 91% weighted in those areas for all the charts. And the comments you see is we had evidence of well-documented and support eligibility and appropriateness on file. And then there's, they said they had the golden thread theme in there when they were talking to us, and the charts. You can see on the right-hand side where it was broken down, where we earned percentages in those specific areas on the charts that they looked at. Eligibility and appropriateness, we scored a 91% in that particular category. Required forms, we had 95.9%. Assessment area, 91%. Service chart area, 96. Plan of care itself overall was 89%. Care coordination area, 81%. Disenrollment, 88%. Total unweighted was 94% overall. And then all that averaged out was 91 in domain 3. So you take that all together, and we had a 91% overall for our actual scoring on our designation, which would have put us in a 3-year, but they gave us a 6-month provisional because of the plan of care issue. So that's very frustrating, because they found, as they were looking through our charts, issues with our plan of care, with signatures and being out of compliance and being significantly over on the 56-day requirement of uploading the plans into the charts, not meeting alignment with the signatures being in date, with being in line with being uploaded, not matching the signature date for the electronic signature for the manual signature dates. So they had gross misalignment for those charts that they reviewed. And they put us in a 6-month provisional status as a result of that. But yet we scored a 91% between domain 1, 2, and 3 for overall, which would have put us in a 3-year redesignation, but the plan of care put us into the provisional. So what does that mean? What that means is we have now a situation where we have to have technical assistance calls over the next 6 months with the Department of Health once a month. We're doing an audit back to August of 23, which we started. We started doing that already, of all the plans of care. We have to look and explain any overpayments and do a disclosure to OMIG for any of those that are not in alignment, that need to do a payback. We have to show the state through these TA calls that we're doing progress towards that. We have to demonstrate to the state that we're taking steps toward that, and prove to them that we're taking steps toward that. If they don't believe that, or we're not proving to them that we're taking steps towards that, it could potentially lead towards de-designation of our program. And then all said and done, because we will get through this and we're going to take the steps we need to take to correct it, because we have a 3-year redesignation scoring, because we have a great program in place. So we're going to make the corrections and get this cleaned up. But they're going to come back and audit us in late summer, and they're expecting a 95 success rate on their targeted plan of care review of the signatures and the alignment for any manual uploads. And again, NetSmart's going to have their new tenant in place in this first quarter for that stopgap to fix it in their system so that you can't just upload a plan of care in there without having the ability to make sure that there's a signature and the plan's got to be able to be approved before you finalize it electronically. So there's going to be stopgaps in place by the end of the first quarter through NetSmart to ensure everything's in alignment. But we have to make sure that we're doing our due diligence as providers, as a network, collectively, to make sure that there's a finalized plan of care with signatures and dates that are in alignment before we finalize it, before that electronic date, and make sure they're all in sync before that goes up and gets sent in and is finalized to go up into MAP. That's the gravity. That's the expectation. So I'm going to pause. That's the reality of where we're at with this. Anybody have any questions, comments, concerns?
I have a question. It's Raquel over at Glens Falls Hospital. I know that it was brought up at last office hours, but I just want to clarify again when we're working with kids and I have a meeting that I document with the parent and the child and whoever else that we reviewed the information that we were going to put in the plan of care. And then I go to meet with them again. So I do it in draft form. I go to meet with them to have the kid sign it because at this point I'm not meeting with the kid and the parent again. If I just have the child's signature, but documented that I had input from everybody, is the care plan considered viable?
I think we discussed last time the parent and the guardian or the parent should be signing unless the child is of certain age. Was the discussion last time, I believe.
I thought it was if the child was 10 and over that they could sign the care plan without the parent's signature. That's why I'm asking, because that makes a big difference. If I meet with the parent and child, I don't always meet with them. I usually meet with them to do the care plan. And then now that we have to have it in draft form and I need to get a signature after the fact, is the child's signature, if they're over the age of 10, going to be sufficient?
If a child's over 10, they have certain consenting abilities. But in ideal situations, there should be a guardian signing off if at all possible.
Right, I understand that, but if we have a certain amount of time that we have to get signatures in, and I can only get the child's signature to make sure that we have it so they're billable, I guess what I'm asking is it going to be acceptable? Because what I'm understanding based on the last meeting is yes, it is, but I don't want to assume that because clearly there's an issue with the care plan. So I want to make sure I'm doing it right.
Right. I think, Raquel, the last meeting was going off from plans that were already in place where the signature was already there and it was already done with. That was a discussion last time, if I'm recalling now, because that was the discussion Paul had brought up, where there was already a signature and the child had already signed and it was done with. So I think
That's
you're
not how I
asking,
understood it, but okay.
You should have a guardian signing off.
Yeah. Hey, Travis, it's Paul. I guess that's probably the $1 million question that we have too is, in this case, whose signature makes the plan of care official? Is it that of the consenter? Is it that of the care manager? The plan set up right now only offers a space for the client and the care manager, not for the consenter. But my supposition is the person who should be signing the plan, if the kiddo is not a self-consenter, should be the same person that signed the 5201. Is that correct?
If there's not you can, more than one person can sign. Just because there's not a space, you can put a signature next to another signature.
Right. I just think that the setup is misleading.
And I think everyone just needs to know what signature seals the deal. And you keep saying a child of consenting age. Is that 10? Is that 12? Is that 18? Like what? I mean, it makes a big difference.
I mean, DOH would say 18, pregnant, married, or a parent. The 10 and 12-year-old consenting abilities are only for certain things.
Correct. So that's why I'm saying you should have a consenting guardian sign if at all possible. When last discussion on the last meeting, Paul, came up when you asked the question, when you had a child that had signed the plan and there was no other signature, was that acceptable? And it was already signed off. You had already had plans that were signed and it was already a done deal. And
right.
Was that going to be, what do we do, was your question. And we said that was better than no signature at all. That was the conversation we were having.
Right. Yeah, I think as CMAs, I think or at least where my head is going when I just heard about the results of the plan of care thing and the redesignation, is that we should probably be looking for best, not better. So just trying to figure out, like, if I'm going to meet with my care managers tomorrow, the message I want to bring to them is, like, when you go out to get a plan of care assigned, the person who makes the magic happen is ? So that if they have access to the parent or the child, but not both at the same time, they're getting the right one.
If I
You know
had,
what I mean?
if I was in a situation where the child was not consenting, I would have the parent signed.
Okay, so
That's
the signer of the plan should match the signer of the 5201 or 5055.
The person who's going to grant the consent should be the one signing in that instance. Yes. Now,
Okay,
if you want, if the child can sign under the parent, that's great, but the parent's the one granting the consent.
Right. So both is okay.
Right.
But like, they should be able to hold the consent to enroll next to the plan, and those two things should match.
Yes. In that instance, yes, because they're granting consent for everything to occur, because the child's a minor, they're not able to consent. And that's much different than the discussion we had last meeting, what we're talking about right now.
Yeah, this is moving forward. The other discussion was kind of like in reverse.
Exactly. So
will
Raquel,
you go to bat for us if we have the signature of a 10-year or an 8-year-old and the care manager?
Exactly. So Raquel's confusion is correct, because she's misunderstanding what that discussion was.
Okay. Yes. So that's incredibly helpful to me and probably the other CMEs that serve kiddos. So thank you.
Any other questions? Okay, please reach out. All right, we have another update around kids. Jessica, did you want this or you want me to do it? I got it. HCBS audit. So we have an HCBS audit. DOH is going to have us do it because we have a small HBS population. So any records that are active as of 1/1 are going to be audited by our health home, and we have to report that to DOH. And we're not going to have our annual HCBS audit due because of the low census, as I just mentioned. But we're going to have to report back the deficiencies from our self-audit back to DOH. And that's going to be back, I believe it's as of early April. We have to get that back. And we already had to submit our audit tool and the HCBS audit tool to them a week or so ago. So that process started up. But we'll get those findings out in the next couple months. And we have trainings coming up, care transition in the first quarter. So that'll be coming your way in the near future as well. So more to come on that. And then news I don't want to share either, but we have to. Taylor Dawson's going to be leaving us. She put her notice in about a month ago. She's going on to greener pastures. So we've been recruiting and looking for her replacement. And going to be hopefully getting her position filled in the near future. But we're asking that folks please reach out on all things quality compliance, and that would also include any questions that folks have been reaching out to her specifically on around MAP, NetSmart, billing, segment related issues, because I know folks reach out to her on all kinds of different topics outside of just the quality compliance specific things. If you could reach out to the health home email, please, so that we can make sure things get answered versus to specific folks. That way we can get things out timely and as specific as possible, because Jessica or I get bogged down and get pulled in different meetings in a lot of different directions, and we may not get back to you as quickly as you may like. And it's not because we're not wanting to, it's because we're getting pulled in different directions. So if it goes through the health home email, it may likely get responded to quicker, even though folks may not think that that's the case. It often is a little bit easier to get back to you faster that way because it can get routed out quicker. So please, if you wouldn't mind going through the health home email, we would appreciate that. But that is the staffing update for the lead. We will make sure that we keep you all posted once we have identified Taylor's backfill. We're going to miss Taylor dearly, and she's been with us. She's going to be pushing 7 years in the next couple months. She's been with HI a long time, and she's had a handful of different roles within the health home. She's grown tremendously in her roles here, and it's going to be a big loss for us. We're going to miss you, Taylor.
Gonna miss you all too. It's been a pleasure working with everybody.
And that is all that we had today. I didn't know if anybody had anything else for us.
Travis, this is Debbie. Can you just again review that part about the kids that was confusing for Raquel in regards to the guardianship sign off and so forth?
Yeah, I would say I would have guardians sign off on plans.
Okay, and whoever signs the 5201 and it should match, you're saying?
We want guardians to be signing things for consent. That should be happening. And if the kids can, if they want to sign in, they can sign, that's great. But the guardian should be signing that stuff.
Okay, I just want to make sure we're clear on that. Thank you.
Whoever the consenter is, right?
Yep, okay.
Any other questions or anything?
Travis, Brandy asked in the chat what the plan is after the 6-month provisional if the 95% isn't met.
It's a good question. Going to be up to the Department of Health what their decision is. We asked the same question. They didn't have an answer for us. That could lead to de-designation in theory. They didn't come out and say they would do that because we scored so high on our other domains, and they did tell us that we are such a strong performer, and we've got such a strong history of being such a strong performer that they didn't foresee us having that be the circumstance, but their expectation is that we're going to fix this and that there will be self-disclosures back to OMEG and that this is going to be rectified, and that's their expectation, and they're wanting this done, and they want to see progress, and they want to see it month to month as we're meeting with them. And they're going to be auditing to make sure that that happens. That was the message, and that was, so they were confident we were going to make it happen and get it done. And we reassured them that we were going to do it as well. So there was a lot of confidence on both sides that it was going to be taken care of. But they didn't come out and say what would happen if we didn't meet the 95%.
Allison asked for the adult plan of cares dating back to 8 of 2023. What are we doing with them?
This is everything. This is for adults and children. This is all the plans of cares. We're looking at everything. The plan of care issue was identified for the network. Even though the redesignation was looking at children's, the plan of care issue was identified for the network. And I do want to remind everyone too, our health home was not the only health home that the plan of care issue got identified for. I don't know if folks remember, it was there was a number of other health homes that utilized in that smart product that I had mentioned that this was an issue with. Our redesignation happened to fall around the same time frame that this came up. The state brought this to our attention in October. Our redesignation fell in November. It happened to be a timing thing for those two things. But there's another health home lead that just did a self-disclosure around all this. And then there's 5 other health homes that are being impacted right now that are in central New York. And then there's one in the Capital District that's going through looking at it right now as well that uses NetSmart. So there's a number of other health homes that have this has touched as well. So it's not just ours. But obviously, we're concerned about ours because this is impacting us. Are there any other questions? Okay, well, thank you all. I hope you all have a good afternoon. I appreciate everything. Take care.
Thank you.